The third type of rate that we'll be covering in this module is infection rates, and these are covered in your textbook on pages 565 to 566. Infection rates focus on hospital-acquired or nosocomial infections, and those are infections that a patient acquires while they're receiving care or services within a healthcare organization. So in other words, they're not tracking infections that patients have when they're admitted to the hospital. There are all different types of hospital-acquired infections. Some examples would be respiratory infections, GI, surgical wounds, urinary tract infections, etc. Hospitals are required to continuously monitor infections, mainly because of the effect that the infections can have on patients and their outcomes. An infection can be life-threatening for patients who are being treated in the hospital. Hospital-acquired infections are a big focus of the Joint Commission, and they are something that Joint Commission has standards on and requires specific reporting on. We're going to look at two types of infection rates that you can calculate. The first is nosocomial infection rates, and the second is postoperative infection rates. Nosocomial infections, again, those that are acquired within the hospital, may focus on, the rates can be calculated to focus on specific types of infections. In other words, you could calculate this rate to only include respiratory infections or any other type of infection that the hospital might be collecting data on. Hospitals strive for a 0% infection rate. The formula for calculating nosocomial infections is the total number of hospital-acquired infections for a given period divided by the total number of discharges, including the deaths, for that same time frame, and then multiplied by 100. The postoperative infection rates are tracked because they may be an indicator of some sort of problem or some sort of contamination in surgery in the facility. In order to calculate postoperative infection rates, it's important to understand the difference between surgical procedures and surgical operations. Your book does cover this in detail on page 565. A surgical procedure is a separate or systematic process on or within the body that can be complete in itself, and it can be performed by a physician, a dentist, or other type of licensed practitioner. The reasons for conducting surgical procedures would be to restore deficient parts, to remove disease or injured tissues, extract foreign matter, assist in obstetrical delivery, so a cesarean section, or to aid in diagnosis. A surgical operation involves one or more surgical procedures performed on one patient at one time using one approach to achieve a common purpose. An example of an operation would be the resection of the intestine and the liver in a cancer patient. This involves two separate procedures, but is considered one operation because it involves only one operative approach or incision. So you can read through the differences there. The formula for calculating post-op infections is the number of infections in clean surgical cases for a given period divided by the total number of surgical operations for that same period, and then multiplied by 100. And you'll notice the definition there for clean surgical cases are cases in which there was no infection present prior to the surgery. Okay, that is all the information relating to calculating infection rates. I have posted some information, a clip from the national news that talks about hospital-acquired infections, as well as a link to some Joint Commission information about hospital-acquired infections. Those are both posted in the classroom for you.